Osun State government has appealed to residents of the state not to panic over the outbreak of diphtheria infection in the state. After the death of the index case in the State Ministry of Health moved swiftly to contain the infection. Hamid Oegbadi reports.
The index case of diphtheria infection in Osun State was a 6-year-old boy who died on July 7th after showing symptoms. The test conducted confirmed that the boy died from the infection. The state government immediately launched contact tracing and activated Emergency Response Center at the State Ministry of Health in Osogbo to prevent the spread of the infection in the state. The Permanent Secretary, Osun State Ministry of Health, Isiaka Adekunle, said the state government is working with the Federal Ministry of Health to prevent the spread of the infection among residents.
We only have this index case. Yes, we may have some suspected cases, but once it has not been confirmed, we cannot say, I can't say this is the number of suspected cases until there is confirmation. So for now, no other case apart from this particular one.
Adekunle appealed to residents not to panic, saying that the infection is preventable and treatable. He advised parents, especially mothers, to ensure that their children are fully vaccinated so as not to be infected.
It is a treatable disease, and above all, it is even preventable by taking immunization. Adults need not to be afraid. Adults need not to be afraid. And if our children had been fully immunized, we don't need to be afraid.
However, most people in the state are not aware of the disease, a pointer that the state government needs to intensify sensitization against the disease. Hamid Oegbadi, Trust TV News, Osogbo.
We're now being joined by Dr. Agbo Neji Ebuta, consultant family physician and vice president, Medical Initiative for Africa. Thank you so much for joining us on the News Hour tonight, Doctor.
Thanks for having me, Ayuba.
Well, Doctor, 30 children have already died in Yobe, with 40 others hospitalized. At what stage can we say that this outbreak is of national concern?
Well, it's presently 8 states are affected. If that number increases and we have a larger geographical area, it moves from becoming an outbreak to an epidemic. And that's when it becomes of significant national concern. It's of national concern now, but it becomes an epidemic and of a higher proportion in terms of concern when most states are affected.
We hear from Osun State there, where the person interviewed couldn't tell us in terms of number of suspected cases. Are we really taking this with the desired seriousness?
Indeed, we are taking it with the desired seriousness, but the room for improvement is the largest room in development, so we can always do better, definitely. So we need to step up awareness. We need to educate our brothers and sisters on what the symptoms are and what they need to do. We need to increase and retrain our health workers at all levels to have a high index of suspicion and train them clearly on initial steps to take and when to refer to a higher level. We basically also would need to increase access to testing, access to interventions. We need to provide antibiotics that will be readily available and effective to mitigate the progression of the disease. And where we suspect that patients have toxemia, we need to be able to assess toxins to address whatever toxic effect the toxins are basically causing. And apart from that, we need to work on vaccination. We have about 5 states in Nigeria, Sokoto, Zamfara, Kebbi, Gombe, Bayelsa, and their vaccination uptake is less than 20%. Some of the states have vaccination of 5-10%. Some of the states affected, like Kano, their vaccination uptake based on the Nigerian Demographic Health Survey in 2018, which has implication now, is around between 20 and 30%. So these are the reasons why we are having outbreaks like this, and vaccination because of poor uptake of vaccinations in certain parts of the country. Some states have very high levels. So to a large extent, poor vaccination has led us here, apart from other things. A weak healthcare system like we have, where we have 30,000 primary healthcare centers, but we only have like 6,000 functional. And how do you vaccinate children if you have only about less than 30% of your health centers functioning? You cannot deliver that. Of course, security has also been an issue in the last couple of years.
Okay, so in that context, how confident are you on our health institutions to contain this disease in the case of an epidemic eventually, if it turns to, or if it gets to that level?
Well, if it turns to an epidemic event, I think we have the capacity, we have the ability, we will be able, with hard work, focus, and political will. I don't think there's anything we cannot achieve that is achievable that we cannot achieve as Nigerians. Once we do the work, we focus, we are diligent, and there's political will.
Okay, what should our viewers do right now as they are watching this to prevent, contracting this disease in a few sentences?
Well, the age that are most affected are under 5 and more than 40, especially young children. If they should confirm if their wards have been vaccinated. If not, they should ensure vaccination. When their wards have any symptoms suggestive of upper respiratory tract infection, they should present early to a health facilities, and where there is a high index of suspicion, medication should be commenced. Apart from that, people should maintain the regular etiquettes of when they have upper respiratory tract infection. In terms of the government and in terms of other key stakeholders, we need to work on our healthcare system. We need to increase access to healthcare. We need to increase. Today, we have one doctor attending to 10,000 Nigerians, which is a far cry from what we have in 2011, where we had one doctor to 2,500 Nigerians. That is poised to get worse. So we need to come up with a bold, innovative strategies to start addressing this health system challenge. Nurses, pharmacies, healthcare centers, and all of that. We need to work on that.
All right. Dr. Abo Neji Ebuta, thank you so much for joining us on the News Hour tonight.
Pleasure. Thank you too.
Dr. Abo is a consultant family physician and Vice President Medical Initiative for Africa. Now, the Presidential Election Petition Court has reserved judgment in the petition by the Allied People's Movement. APM is seeking the nullification of Tinubu's election on the grounds that his running mate, Kashim Shettima, was not qualified to contest, having allegedly engaged in double nomination. After parties adopted their final written addresses, the chairman of the panel, Justice Haruna Tsammani, announced that judgment was reserved until a date to be communicated to parties. Justice Tsammani added that the court plans to deliver judgment in the petition by the APM the same day with those of the People's Democratic Party and the Labour Party. Respondents in the petition are the Independent Electoral Commission, that's the Independent National Electoral Commission, the APC, Tinubu, Shettima, and Kabir Masari, who acted as APC's placeholder before Shettima's nomination. The APM's petition is anchored on the sole ground of non-eligibility of the APC presidential ticket, wherein they have raised the issue of placeholder Kabiru Masari as the vice presidential nominee of the APC and his eventual replacement with Kashim Shettima.